Pablo Leone. I'm assistant professor of medicine at the University of Iowa, and I'm very interested in researching male breast cancer. I'm going to give you a brief overview about our project that we're presenting today at the ASCO annual meeting in 2016. So, our study focused on the objective of analyzing locoregional treatment in patients with male breast cancer at early stages. So because of male breast cancer is an infrequent disease, unfortunately there is no prospective data on guidance on locoregional management. And so our goal was to explore the differences in different treatment strategies for breast cancer and to see how the overall survival is impacted by each of those treatments. So what we did was we looked at SEER data. We took an analysis sample of patients who presented with T1A, B, or C with no negative disease and no metastasis. And we took this population in particular because this is the population of patients where locoregional treatments are, the outcomes of those treatments are the least likely to be impacted by systemic therapies. And so what we found was we identified 1,263 patients, and we found that the overall survival at 5 and 10 years was of 85 and 66%. We noticed that among the 1,263 patients, we found that T1C tumors represented the majority of them, 72.8%. And we found that this group of patients of T1Cs had higher risk features compared to other groups. So they were more commonly older patients with higher tumor grade, with higher rates of total mastectomy, and higher risk of mortality from breast cancer. But what's interesting is that when we looked at surgery and specific details about surgery, we found that mastectomy was performed, a total mastectomy was performed in more than 70% of each category, of each tumor size category. So even in patients with T1A tumors, which is tumors less than 5 millimeters in size, had 70% rates of total mastectomy, which to us was impressive. And the same goes along with lymph node examination. So in total, for the whole population, 44.1% of patients had more than 5 lymph nodes dissected or resected, taken out. And this is in a population where we know that these are patients who are node negative. So it was a very large number of lymph nodes that were removed. So when we looked at the survival, we found that survival was different according to sizes, but not very not in a large extent, and this is because we're comparing T1A versus B versus C as opposed to T1s versus T2s or T3s. So survival for T1C is shorter, and then when we looked at surgery outcomes, we found that the group of people who did not do surgery, which was very few, only 15 patients, did significantly worse in terms of overall survival. But interestingly, the group, which was our main interest for the study, was that there was no difference in survival between the group who did breast conservation and the group who did the total mastectomy. So survival was exactly the same whether you did one or the other surgery. And the same goes along when we looked at the lymph node surgery. So patients who did more than 5 lymph nodes dissection or 1 to 5 lymph node dissection, they lived exactly the same over time. There was no difference in survival for that. This is the univariate and multivariate analysis, and we found that older patients was a predictor of worse survival, higher grade also. No surgery was a predictor of poor survival. No lymph node examination was a predictor of poor survival as well. And a recurrent theme in breast cancer analyzed by SEER is that unmarried patients also have shorter survival as well. So what we concluded from our study was that based on this data and based on the unfortunate situation where it is quite unlikely that a large prospective randomized trial will be feasible to be conducted in male breast cancer with this specific disease type, with a small tumor size, we think that efforts should be taken to try to decrease the high rates of total mastectomy and especially the high rates of extensive lymph node examination of more than 5 lymph nodes resected. So hopefully that will be a next step in a future direction. Thank you.
Thank you so much, Dr. Leone. And representing the Male Breast Cancer Coalition. We appreciate all you're doing in male breast cancer research. Continue your success. Thank you so much.
Thank you. My pleasure.